Over the past year, overdose deaths have been on the rise nationwide and right here in Arizona. That's according to the CDC. And those who work with people who are struggling with addiction say to change that trend, the focus has got to go beyond opioids. State leaders are considering a bill that would legalize syringe exchange programs. ABC 15's Claudia Rupsich explains why this bill could help save lives.
Selling and handling drugs and just fighting with people and stabbing people. That was my life in prison.
When Andre Norman was younger, he was in the streets, involved in gangs, drugs, and violent crimes.
So I saw a lot of people suffering, and myself was in there suffering.
6 years in a prison, he decided to turn his life around. He taught himself how to read, got his GED, and after he got out, he became a Harvard Fellow.
And I spent the last 21 years of my life serving the community of America to overcome addiction and overcome not feeling wanted.
He's advocating for Senate Bill 2050 that would legalize under state law the use of syringe service programs that would allow for the exchange of dirty syringes for clean ones.
It puts the structure in place so that they're done right, because we know that they can be done wrong. And right now, those that are in place are, number one, illegal, and they're not very well run, and so we're trying to fix that.
Senator Nancy Bartow sponsored the bill.
We've really reduced opioid overdoses in terms of prescription opioids, but overdoses are through the roof through illegal use of drugs, and that's what we're trying to address.
These programs allow providers to create relationships with drug addicts. They can refer users to treatments, HIV, hepatitis, and STD testing, and provide overdose prevention education.
Every addict, every sibling, every loved one deserves this program because we're talking about saving lives.
According to Sonoran Prevention Works, 17% of HIV and AIDS cases in Arizona are related to injection drug use.
If we don't give them clean needles, they're going to use drugs anyways. So what's the back end of not having clean needles? A spread of crazy diseases that we don't want and medical costs that the state doesn't want.
Supporters believe this will allow nonprofits and health programs to meet addicts where they are.
I am an example of many that success is possible. And when you go out and you see this person who's suffering, tell them, I saw the hope, I saw the transformation in somebody else, and it can also happen in you. Belief starts with hope.
The bill has had bipartisan support. It passed unanimously in the Senate. It'll now go to the House for a vote. I'm Claudia Rupsich, ABC 15 Arizona.